Hatvet PHARMA welcomes you to the ocean of practical knowledge about small animal practice, that is, Hatvet's YouTube channel. We are thankful to our honorable speaker and session moderators for sharing their valuable time and knowledge with us.
So, my dear friends, welcome to our webinar. This is just a small webinar which shows how to deal with our feline patients inside our clinic. It is in this webinar, most of the things we know, a general practitioners know, but to sharpen your ideas in feline medicine, just as a beginner, how can we practice in a feline clinic or deal with a feline case? That's all. So, the first thing we have to keep in mind is cats are not small dogs. It's very important. Cats are almost entirely different from dogs. Their food habits, their behavior, their metabolism, their digestive properties, their needs, everything are different from the dog. So cats are not small dogs. Both are entirely different. And so either be a feline clinician or be a canine clinician or can be both small animal clinician. But not the same. Lot of differences. This difference we have to study in detail. For example, let me narrate something like the capillary refilling time in the cat is longer than the dog. And the heart rate, it can go even normally up to 250 beats per minute. So that is a normal heart rate in the cat. Then unlike in the dog, there are four pathways for the hepatic detoxification or metabolism, like glucuronidization, methylation, acetylation, and active transport. Out of that, we know very well about glucuronidization. It is the most important. We know the enzyme glucuronyl transferase, and this enzyme makes hepatic detoxification very smooth. It is abundantly found in the canine liver, that we know very well. And the cat liver, it is low in amount. So, it is the most important one. Many drugs, so that since this glucuronidization is the most important one, and it is in very low amounts, this enzyme is very low in very low amounts, very low levels, many of the drugs are contraindicated. Many of the foods or the drugs are contraindicated in cats, like acetaminophen and its derivatives, salicylates, acetylpropanoids, so many, dimercaprol, British anti-leucide, then this pyrethrins, then heavy metal compounds. Lot of drugs are contraindicated in the cats. And cats, unlike the dogs, they require lower IV fluid rate. If you are giving for the cat very fast IV, the cat immediately will die. This happened several times. So it should be very slow. The drip rate should be very slow in the cat. It should be 2 drops in 1 second maximum, nothing more than that. Because a cat's blood volume is only 55 ml per kg. So for a 3 kg weighing dog comes around 150 ml maximum. And for the dog, it is 78 ml per kg. We know how much it is. Then tachypnea in the cat is very oftenly found. It is found in, especially if he has open mouth breathing, putting out the tongue, etc. Putting out the tongue and gasping. After in certain abdominal disorders like enlarged organs, fluid accumulation inside the abdominal cavity, bronchitis, congestive heart failure, anemia, diabetes mellitus, Cushing syndrome, fever, heat stress, pleural effusion, pneumothorax, etc. And heat stress or pleural effusion are very common where you can feel open mouth breathing and pulling out of the tongue, putting out of the tongue. So in cats, we have to look for certain things and high Heinz body formation, especially acetaminophen poisoning, Heinz body formation, intravascular hemolysis, and toxicity. Lot of drugs are there. If you go for the contraindication, lot of drugs are there, like paracetamol, acetaminophen, or even acetyl salicylic acid derivatives, carprofen. Even it is written that meloxicam should be used with caution in cats. But from my practice, it is safe. Carprofen, pyrethrins or pyrethrinoids, amitraz, of course, propofol, cypermethrin, propofol, azathioprine, opioids, opiates, 2-palm, dimercaprol, all these things. Then coming to the commonest complaint of the client is anorexia of the cat. During anorexia, hypokalemia and hepatic lipidosis develops very fast and it can be fatal in 48 hours. So always address anorexia in the cat in a very true manner, especially with IV fluids. And hypoglycemia occurs as when time goes on. The first to occur is hypokalemia, immediately followed by hepatic lipidosis. So emergency parenteral fluid therapy is a must. Whatever be the cause, to assess the level of dehydration. If possible, since it is highly sensitive to serum potassium levels, always try to assess the blood potassium level. They are obligatory carnivorous animals, so oral glucose is not needed. But when these are obligatory carnivores, they will pick up, they will eat, or they will gulp this muscle fibers, and muscle fibers will contain glycogen. And hypoglycemia is not a primary feature. Of course, it will occur later. Dehydration aggravates quickly, worsening with hypokalemia. In 24 hours, this will happen. So this is how we take the CRT, which is much prolonged than in the dog. These are Heinz bodies, especially found in acetaminophen toxicity, in paracetamol toxicity. I've seen one of my clients telling me that, doctor, my cat is having fever. I gave Fepanel syrup in the morning, but fever is not arrested. Again, in the noon, I gave some more Fepanel, but still the fever is there. What can I do? I said, nothing you need to do. Nothing. You need not bring it to me also, because you already killed the cat. So that much toxic is paracetamol. But even in our John's pharmacology, it is said that it is toxic, but the dose is written, it is something around 1.5 milligram per kg. Paracetamol can be given, it is said. But of course, practically it is very poisonous. Then we always give this pyridoxine. It is pyridine to aldoxine methionine, pyridoxine. It is available as PAM. It is an enzyme reactivator used in OP poisoning, but this is contraindicated in the cat. Generally, cats, they won't eat any OP poison because they are highly sensitive to poisonous substances, and they won't touch even a poison like which is having bitter taste. They're highly sensitive to bitter taste. This is God has given rather than human beings. Dimercaprol, British anti-leucite, and this is used as a chelating agent in heavy metal poisons, which is contraindicated in the cat. So blood works can be done in the cat, like CVC. For LFT, of course, we can go for ALT and GGT. ALT is liver specific for the cat also, but the dog is highly liver specific. In the cat, you can go for ALT as well as GGT. For the kidney function test, we can go for blood urea, creatinine, assessment of potassium and phosphorus. Phosphorus is very much essential, especially in CKDs, because in CKD, due to hyperphosphatemia, there will be hyperparathyroidism, producing mobilization of calcium from the jaw bone into the blood. And so there will be a condition known as rubber jaw syndrome. The jaw bone, that is a mandible, will become brittle, rubber jaw syndrome. And there will be easy fracture of the mandible during that time in CKD of felines. And the normal creatinine level can go up to 2.2 milligram per deciliter, up to even 2.5 milligram per kg liter deciliter. It can be considered as normal. So always in anorexia, go for IV fluids, always, because hypokalemic can develop, and the best choice of fluid is reverse lactate. And sometimes the cat may not cooperate, and so you can go for xylazine 0.2 milligram per kg intramuscular, knockdown, and then give the required fluid with the cannula or scalp set. Fix a cannula to S24 gauge, that is yellow one. You can select the cephalic vein, saphenous vein, medial thigh vein, or jugular vein. The only fluid should be given to the cat is oral. There is no need of any glucose containing fluid as such. But as when there is hypoglycemia developed, you can go for glucose containing fluid also. Otherwise, oral can be considered as the best choice of fluid. And no salty preparations like sodium chloride containing DNS, normal saline, etc. No salt for the cat. It is a universal principle. If no much dehydration, you can select even subcutaneous site. For every subcutaneous site, the maximum fluid that can be deposited is 10 ml per kg per site. If there is massive or dangerously low hypokalemia, we can add potassium chloride, the same 15 milliequivalent per liter. And in the kittens and our neonates, etc., if there is dehydration, you can even drill the femoral hematochondrial fossa, introduce the needle into the femoral marrow, and give it intraosseous. That acts as a rigid vein. And oxygen therapy also should be done in cases of anorexia if it is in shock. So this is the access to cephalic vein. This is the raising the cephalic vein. It is very easy. Raising the cephalic vein is not tortuous, it is very straight in the forelimb. Very easy to get. Even cannulation is, I always find that it is much easier than in the dog. This medial thigh vein or the medial saphenous vein can be used either for blood collection or for IV fluid administration. Even you can use cannula here. I used to cannulate. Or the lateral saphenous vein can be used as the case of dogs. Better not to give any colloids in the cat because the cat will die because only a small quantity of fluid. It is only 4 ml per kg. How much we can give? So better not to give colloids in the cat. Then all cephalosporin injections can be given subcutaneously. We know cefovecin. Like that, ceftriaxone, cefoperazone, everything can be given subcutaneously. Ceftriaxone can be given subcutaneously. So ceftriaxone, tazobactam, ceftriaxone sulbactam, all these things can be given subcutaneously in the cat. It's very safe. That amoxicillin sulbactam should not be given subcutaneous, should be given intramuscular or IV in the cat. And better we use insulin surge injections for IM like xylazine, ketamine, whatever be the medicine. Otherwise, too much of pain will be there. You know, it is a very small animal, just 2 or 3 kilograms, just like a puppy. See, it is highly painful if you are using that 2 cc syringe and 24 gauge needle. In the insulin syringe, we are keeping the 26 gauge needle. That will be sufficient. If vomiting is not so frequent as in the dog, it is not so frequent. Vomiting is not so frequent as in the dog. The cat will not vomit too much. Vomit will reject the food, etc. Otherwise, it is not. Like in the dog, it will not be vomiting all the time. We can give metoclopramide, IM or IV. Oral poisoning is not so common in the cat because the God has given certain facilities for the cat. They are highly sensitive. They will sense it. They will sense the poison. It will be almost bitter in taste. They will not. They will smell it and they will keep themselves away from the poison. And frequent vomiting is not a feature of felines. But gagging and salivation is a common feature. While you give some compounds orally, medicines orally, etc., it will gag, it will profusely salivate. It's also normal things. But the esophagus is very sensitive, especially when we are giving doxycycline. It should be given along with food only. Otherwise, severe esophagitis and esophagitis sometimes it can produce spasms and strictures of the esophageal mucosa. And antiemetics, especially antiemetics such as metoclopramide, phenothiazine derivatives, etc., injections, and even domperidone orally. All these are dopamine antagonists as well as prolactin agonists. They will produce hyperprolactinism and lactation or galactorrhea in the pregnant cat. And meat or fish, these are all general features which we should keep in mind. Meat or fish is necessary in a recovery date from convalescence phase. There are not sweet sensitive taste buds on the tongue of the cat, they cannot sense sweet. So no need of applying it into honey and then give it. No need, no. It will not work at all. But bitter and salty taste can be sensed very well. Now this is when there is anorexia in the cat, the first event to happen is hypokalemia. When there is hypokalemia in the cat, especially after 24 hours of anorexia, especially by 48 hours, severe hypokalemia can develop. They are highly sensitive to the potassium level of blood. And so, when there is hypokalemia, it assumes this type of a posture. It is highly pathognomonic posture to feline hypokalemic myopathy. There will be severe ventroflexion of the head, and sometimes the nose will be touching the ground or the tabletop. But it can move. There won't be that much of flexity of the limbs, but there will be flexity of the neck muscles. Due to that, there is no knuckle ligament in the cat, in the felines. So the neck muscles become flaccid, they lower the head, hang the head down, produce this type of pathognomonic postural defect. Feline hypokalemic myopathy. Whenever you see this, immediately assume that it is hypokalemia. You can check the blood for hypokalemia. And the picture of hypokalemia. This is typical ventroflexion due to hypokalemia. Sometimes the nose tip even touches the ground of the tabletop. Then diarrhea sometimes occurs in the cat. It again produces severe hypokalemia. Can be due to helminths, roundworms, hookworms, tapeworms, etc. are found. Especially large amount of helminths are found in young ones, and deworming is a must in the kitten. And the best dewormer is nothing but fenbendazole 50 milligram per kg orally for 3 days. Ordinary antidiarrheals can be used. Antidiarrheals are contraindicated like Lomotil. This also I have got 2-3 cases. The man has gone to the medical shop. My cat is having diarrhea. The fellow inside the medical shop, he gave some antidiarrheal to this man. He gave this and the cat died. I asked him what was the medicine. It was Lomotil. Since Lomotil contains diphenolate, all these are opiates. Opiates are contraindicated. Frequent antidiarrheals, if you are giving frequent antidiarrheals for the dog and the cat, unlike the dog, it can produce megacolon. And also diarrhea, it is very common, very commonly found. It is a constant diarrhea which is zoonotic in nature. Then toxoplasma, in loose stools, toxoplasma oocysts can be found. As again zoonotic. Uncontrolled yellow, pasty, loose stools all the time. It is very common. Those are sequel to chronic giardiasis. That is inflammatory bowel disease. Very difficult to manage. We can try a course of omeprazole plus a course of methylprednisolone orally. So this is very common. We might have found so many times in our clinic. Yellow pasty stools dripping all the time without any control. Too much acute diarrhea as infectious viral diseases such as Feline Panleukopenia, FIP, etc. Those are also common. Hypokalemia also occurs in diarrhea, severe diarrhea. The muscle has abundant glycogen. So hypoglycemia is not a common feature, but it can occur later. Stool examination is very important in diarrhea. The best antibiotic in the cat, oral antibiotic for against diarrhea is ofloxacin metronidazole combination or levofloxacin ornidazole combination. This can be given, safely given. Injections can be given as ceftriaxone or combination of ceftriaxone with the tazobactam or sulbactam or amoxicillin or sulbactam. Long-term use of oral antibiotics can cause gut flora disturbance. So we can go with some prebiotics or probiotics if necessary. Generally, cats below 1 year of age can tolerate the cow's milk very well. It can tolerate lactose. So it can be used as a good substitute for the food as well as a probiotic. But if it is given in cats above 1 year of age, mostly it cannot tolerate lactose, and lactose intolerance diarrhea can occur in adult cats. And you can fix the scalp vein set or the cannula and give IV fluids and antibiotics. If it is not cooperating with you, you can knock down with 0.2 milligram per kg silicine and then safely you can give it. You can cannulate it. And if the client is not ready to sedate the animal, okay, then you can go for subcutaneous ringer's lactate. That also is sufficient. In chronic constipation, tenesmus and fecal retention, megacolon also can be suspected. See, these are stained Diarrhea in the feces of the cat. You can see the flagellated organisms, highly zoonotic in nature. These are the fine round rooms, typical round rooms. All the doctors might have seen several times the round rooms, and fenbendazole is the best anthelmintic for the cat. This is the hookworm of the cat, tapeworm. All this is familiar. This is how we give subcutaneous fluid. Subcutaneous injection always should be given on the dorsal region only, never on the ventral region like the flap of the flank. Never give it on the flap of the flank. Always on the scruff of the neck or over the rump. Preferably on the scruff of the neck where there is too much of loose skin. And sometimes in small kittens and neonates, etc., you can go for even intraosseous fluid administration. I do it very regularly. This is generally done. This is femur. You can see the head of the femur, neck of the femur, retrotrochanter. You can see the intertrochanteric fossa. Through the intertrochanteric fossa, you can drill down the needle into the marrow, and you can administer the fluid, any amount of fluid which we calculate. But this is a painful procedure. Should be done only in recumbent animals after proper lignocaine infiltration. So this bone marrow can act as a rigid vein. And again, in macrocytic lactone, ivermectin toxicity, ivermectins are not contraindicated in felines. You can use it. So if there is a toxicity, we can go for intralipid infusions, and it is available as a 20% milky white solution emulsion. The dose is 1.5 to 4 ml per kg IV as a bolus, followed by 0.25 ml per kg as a CRI over 1 hour. Never mix intravenous lipids with any other fluids. It is just a 20% colloidal suspension. So 500 ml of the bottle, 250 ml, and collapsible bottles are also available. Packets are also available. Then another commonly presenting disease is FLUTD, feline lower urinary tract diseases, especially very common in Persian cats. Why? Because Persian cats generally are fed with dry matter, dry food. Dry food contains only 5 to 10% of moisture. The requirement of moisture, requirement of fluid, requirement of oral water in the cat is 50 ml per kg per day. So if it is 3 kg weighing cat, it needs 150 ml of drinking water or 150 ml of fluid from succulent food. We are giving 50 grams of dry food or 100 grams of dry food containing only 5 to 10% moisture, maximum 10% moisture we can say. In 100 grams there is 10 ml of water. Just 10 ml of water. It needs 150 ml of water. So how can they meet this water demand requirement? Drinking water, sometimes it may not drink also. So you have to give succulent foods, like if it is not in the captive form, it will go on with the meat or fish. It contains 70 or 80% water. The water requirement will be met with. We are giving it. We are keeping it in captivity and giving less water. That is how feline urinary tract infections or FLUTD occurs. And one of the reason is, or the main reason can be even stress. Change of the diet, change of the master, change in the house, change of the cage. Everything can produce stress. It's very common. There will be urine retention. Straining and dysuria, sometimes no flow of urine at all, complete blockade. It will be spasms of the urethra. It can be acute and complete urine blockade. Urine will concentrate and precipitate. Scan for any stones inside. There will be high retrograde upward, retrograde pressure on the ureter producing hydrouretus and even renal edema. That is hydronephrosis. And there will be palpable nephromegaly in such cases. This bladder is highly elastic in the cat, and that becomes too much distended. And rupture of the bladder is very rare in the cat because it is very elastic. Tom catheters are available, FG3 and FG4. We can sedate well with salicine and catheterize. If it's a complete blockade, wait for a week. Cystocentesis on every alternate days. Perform cystocentesis very well. It's excellent. Nothing will happen. There won't be any rupture because it is highly elastic. There won't be any rupture of the bladder. Once rupture has happened in one of my patients. So you go on with cystocentesis every alternate days. So one fine day after 3 or 4 aspirations, you can see wetness at the tip of the penis. By that time, the urine starts flowing into the penis or flowing out of the penis. When flow is started and there is a good flow, you can stop cystocentesis. Urinalysis and blood works are necessary. Urinalysis, of course, definitely. The stones, crystals, pH of the urine, specific gravity of the urine, everything is important. Specific gravity is highly important. Hypercinuria, we have to rule it out. The presence of leukocytes, bacteria, etc., and UTI. If there is pollakiuria, frequent urination. So to alleviate stress in the FLTD, we can even go for stress hormone injection, like corticosteroid, prednisone can be injected along with the antibiotic. Urinalysis after cystocentesis is necessary. Look for the pH and specific gravity of the urine. See, if you are not able to see the urine at the tip of the penis after 3 or 4 cystocentesis, then we can go for a laparotomy. We can go for a tube cystocentesis with Foley's catheter. And it can be retained until the penis gets wet, until the urine is flowing out through the penis. It will definitely occur. Or otherwise, if everything fails, then total pectomy is the only measure. Check the pH of the urine, and if it is alkaline, acidify the urine of using vitamin C orally, or even commercial methionine oral paste is available. Always under an antibiotic umbrella, that is very important. Adult intact males always spray pungent odor urine normally, and it is not due to a disease. And this can sometimes be stopped by orchidectomy in the male. So, is a Tom catheter, FG3 or FG4 is available, you can make use of it. Then another disease very commonly found is vestibulopathy, idiopathic feline vestibulopathy. Adult and young ones are equally susceptible. There will be sudden onset of tilting the head, shaking the head, rolling the eyes, nystagmus, staggering gait, stiff gait, frequent falling down, rolling on the floor and staggers, circling, nausea or vomiting. These are the signs of feline vestibulopathy due to imbalance of the vestibular apparatus. So it's a very difficult case to deal with sometimes. You can check the ear canal well for mites. Generally, it is self-limiting. And in approximately 3 weeks, I have seen that it was self-limiting. And so we can try CPM injection. See, according to the rules, we have to ascertain whether it is a central vertigo or a peripheral vertigo. Because I'm not going deep into it, but in fact, if you get such signs, we can try CPM injection, IV fluids in anorexia, etc. Some other infectious diseases such as herpes, which is very common, especially in small kittens or feeding kittens. There will be conjunctivitis, ocular discharges, sneezing, nasal discharge, highly contagious, salivation, pharyngitis, lethargy, inappetence, fever, and sometimes cough. Signs may last for a few days to a few weeks, and shedding of the virus typically continues for around 3 weeks. So it is highly contagious. The treatment is only it's viral infection, herpes, general antibiotics, eye drops, nebulization. Then an antiviral drug can be tried, famciclovir. I have never tried it. I tried acyclovir. I have never tried famciclovir. Then that's it. Same thing, almost same thing. Feline rhinotracheitis caused by feline herpes virus 1. It has fever, frequent, is highly contagious, and we can prevent it by vaccination. Our so many vaccinations which contains 3 vaccines, 3 antigens are available. Fever, frequent sneezing, conjunctivitis, rhinitis, and often salivation, excitement or movement may cause even some small movement even can cause sneezing. Once infected with feline viral rhinotracheitis, it shows the disease symptoms in 2 to 5 weeks. That is the incubation period, 2 to 5 days. Is highly contagious, can infect other cats during this incubation period. In most cases, once symptoms appear, the active infection will last for about 10 to 20 days. Sometimes even becomes fatal. IV fluids to prevent dehydration from excess. See, these are all viral infections. Only we can do conservative management. IV fluids to prevent dehydration from excess nasal or eye discharges. And anorexia will be there. Antibiotics should be given to prevent secondary bacterial infections. Topical eye medications, antiviral medications, acyclovir eye ointment, and famciclovir eye ointment, orally, etc. can be given. Probiotics can be given. Then ferilizine, L-lysine supplements to boost the immune system. Environmental humidification, etc. can be tried in such patients. Then feline parvo. It is almost a counterpart of canine parvo, but canine parvo and canine distemper are not the same, they are different. But feline parvo, feline distemper, feline panleukopenia, etc., the same disease itself. It is a pantropic virus having diarrhea, vomiting, fever, etc. Like in the case of canine distemper. Can cause severe disease, and mostly the cat will die. There is no treatment. We can go with conservative management, especially kittens. Very fatal. The disease is always also known as feline panleukopenia, highly contagious. Feline infectious enteritis and feline distemper. It is a counterpart of canine parvo. RFIP. Nowadays it is very common. We used to see it very commonly. The wet form or the dry form. Wet form means the main symptom is ascites. The dry form, there will be neurological signs. It's highly fatal. Of course, the treatment is there. Some cats may show mild upper respiratory symptoms such as sneezing, watery eyes, and nasal discharges. while others may experience mild gastrointestinal signs in this. There we have a Revolta test by which one drop of the ascites fluid can be taken. It can be dropped into acetic acid or vinegar. If it is being suspended, we can say it is positive for FIP, especially wet form of FIP. So that is a Revolta test. Or if it is dispersed, it is not FIP. So that can be done. Treatment, of course, it is there. Oral treatment, this ex-Rafcon, it is not available in India, but some of our multi-specialty hospitals are having this drug. It is highly effective without causing serious adverse effects. 400 milligram tablets are available. It's very expensive. 100 milligram per kg body weight in empty stomach. And if there is severe uveitis, ocular form, we can take 1.5 or we can offer 1.5 times increased dose of ex-Rafcon, or 2 times the dosage if neurological signs occurs. 12 weeks treatment is recommended and 16 weeks treatment is recommended in uveitis and neurological signs if occurred. So this is just an eye-opener in feline clinical practice. See, in feline FIP, there is another disease, another treatment, remdesivir. Remdesivir is also very commonly used. So this is just an eye-opener of feline clinical practice. If we are going deep into feline clinical practice, lot of diseases are there. Just this is how, just for beginners, just how to manage. What are the difference between the canine patient and general difference between the canine patient and the feline patient? How to manage immediately with the feline patient. That's all that I mentioned, and never in detail. See, if I'm going deep into all these things, I have to put more slides and I have to take more than 4 or 5 hours to explain these slides. So, with this, I am concluding my small webinar on feline medicine or feline medical practice for the beginners. So, this is the ex-Rafcon medicine. The injection tablets are available. And my dear friends, with this, I am concluding. And so, thanks everybody. Thank you everybody. Bharat Mata Ki Jai. Long live our mighty nation. Thank you very much.